Talk to your kids about suicide now. That's the urgent advice of a therapist who's concerned as her clinic has seen demand for services quadruple since the pandemic began.
KITV4's Diane learns what parents can do right now at home so the crisis does not worsen.
Mental health challenges made worse by the pandemic are at crisis levels. This week, the U.S. Surgeon General issued a public health advisory on the mental health challenges confronting America's youth. Halen Dennison is the clinical director for Integrated Health Hawaii, a healthcare company.
It's been really challenging. Since March 2020, we've quadrupled in patients under 18. I think, the pandemic has really just exacerbated mental health issues.
You say you've been doing this kind of work for 15 years, and in that decade and a half, you've never seen social services and mental health services booked so much.
It really is heartbreaking, not just in the state, but across the entire nation. There's a shortage of mental health specialists. We've had kids right now who are just not even able to get into the inpatient hospital when they attempt suicide.
What can a parent or a guardian do in the time? Should they have a discussion with kids about suicide straight out?
I think so. Just even though it might feel super uncomfortable, just saying, hey, do you have any thoughts of not wanting to be here anymore? Do you have thoughts of dying, right? Saying it straight, just directly like that is going to really increase your chances of your child being able to talk to you about it.
A lot of teens don't want to say this kind of things to their parents.
Yeah. And you know what? It's very, very normal and I think expected for adolescents not to want to talk to their parents about it. It only takes one supportive adult to really decrease, suicide by 40%. And it could be a counselor, it could be a teacher, right? And honestly, it could even be a friend.
Having a trusted friend to talk to is part of your safety plan. What is that?
Come up with 3 people you can call or text. Can we come up with 3 places you can go? Can you come up with 3 things that you can do, such as I'm going to take a walk. Get your kid to understand it's a big feeling, it's a hard feeling, but it will pass.
Halen Dennison, Clinical Director of Integrated Health Hawaii, thank you so much for talking to us. Diane, KITV4 Island News.